think increasingly I'm having complex children, many of whom have developed school refusal, maybe out of school, home educated, because their needs have become so overwhelming. I'm Dr. Georgie Siggers. I'm a consultant community paediatrician and I specialise in neurodevelopmental assessments of children, really from the age of about 1 up until 18. There are many girls who don't present in the way that we would typically think of with ADHD. So I think it's probably fair to say that most lay people and teaching staff will think of ADHD as a disruptive, loud, boisterous boy who can't sit still at the desk and who is causing a little bit of chaos in the classroom. But boys and girls can present very differently to that. Children are very good at trying to cover up what they find difficult, and particularly girls. Children who have ASD and ADHD can present very differently in different settings. I think there's a very complex interplay between the two conditions, and I think that's why it's so confusing for schools. There won't be enough evidence for them to be considering a referral maybe, or they've not really quite worked out what's going on. And parents the same. Essentially you are relying a lot on the information that you get from home and school, mainly in the form of rating scales. And rating scales are really, really helpful, but they're not precise. Sometimes teachers or parents may overrate a child's symptoms, or they may underestimate the symptoms that they're seeing. What you're having to do when you're making a diagnosis of ADHD is find the evidence, firstly, that the child is affected by inattention, impulsivity and high activity levels. To date, I've been using the QbCheck as part of a comprehensive assessment. I've certainly found that increasingly useful in children that are presenting with a range of difficulties and have lots of different diagnoses, so it just can help to add that confidence. It's also a really good way to break the news to a child and their family about diagnosis, because you can take them through step by step and show why they are experiencing a particular difficulty compared to their peers, and then at the end you can explain why you think that's happening. If you're reassuring them that the child doesn't have ADHD, you can talk about all the things that you've noticed that would go against ADHD, and then if you have the QbCheck, shows that they're performing on that compared to their peers, and it's very clear in the pictures that they're very similar. You can just provide so much more reassurance.